When you're planning on doing an ultrasound of the abdomen, obviously it's important to know where all the parts are that you're trying to find. And so obviously knowing the anatomy of the abdomen becomes really important. And this is a fairly logical carryover from radiographic anatomy. If the organ lives in one place on a radiograph, it's probably going to live in a pretty similar place in the abdomen on an ultrasound. But you do have to think about things in a little bit more of a three-dimensional sort of way compared to radiography. And so this is sort of a review of kind of thinking about the spatial alignment of everybody in the abdomen. And before you guys ask, no, this is not my truck. And no, it has absolutely nothing to do with this lecture. But it's a pretty cool looking truck, I think. So, anatomy. Remembering how we obtain sonographic images. Each of those images represents a slice, and it's barely three-dimensional. It's almost a two-dimensional slice. So each slice is an individual plane. Nomenclature is pretty much as we've learned from before in anatomy. So you've got transverse, sagittal, and dorsal planes, as well as any oblique that you want, because you can freely maneuver the ultrasound probe. CT and MRI also obtains images in slices, so CT references and MRI references are actually pretty good for reviewing your anatomy. There's your simple schematic of a dog sliced into the various parts, your dorsal plane, your sagittal plane, here labeled as a median plane because it's a mid-sagittal plane, and then a transverse plane. And these are going to be the primary planes we're kind of imaging in, although again, not all organs live in perfectly a square alignment, and so you will be doing various oblique planes to get the perfect images of some of the organs. When we're imaging specific organs, we usually talk about the planes through that organ that may or may not relate directly to the plane of the animal, because it's more important to figure out where you are in the organ rather than precisely in the animal itself. And so we usually talk about short axis and long axis of an organ, and basically a long axis is, like it sounds like, the one that makes it look the longest, and short axis is the one that makes it look the shortest. So in a kidney, you kind of get that long oval appearance in the long axis, and you get a squatty little circle in the short axis view. And like I just said, organ planes don't necessarily correspond to what the body planes are. So the long axis of a kidney is the sagittal of the patient's body, so fairly comparable sort of plane, whereas the long axis of the stomach is actually a transverse plane of the dog's body or cat's body. So again, you just have to make sure that whenever you're describing the plane you're acquiring, make sure you're being detailed and describing it in terms of either short axis or long axis of the organ, or what plane of the body you're in. Scanning position is kind of a personal preference thing. A lot of people like to scan abdomens with the patient in dorsal recumbency. That's often easiest to get nice images. Lateral recumbency works well too. It actually works better than dorsal recumbency sometimes. It's a little bit easier to hold the animal. So if you don't have a lot of restrainers, if you only got one person to hold the animal for you, that can be a lot easier in lateral recumbency than in dorsal recumbency. But it means you have to flip the animal over midway through to see the other side. Echocardiography, limbs, often done in lateral recumbency. We don't do much standing ultrasound except in large animals. As far as the order of going through the abdomen, it doesn't really matter. Whatever seems logical to you is the best way to do it. The most important thing is that you're consistent, so that you always look at all the organs, you always look at them in the same order, so you get used to what things are supposed to look like, and so you definitely will define and identify things when they're not what they're supposed to look like. Various patterns that people tend to do. A lot of people start either cranial abdomen or caudal abdomen and then go either clockwise or counterclockwise. Again, it just kind of depends on what you like. If you're doing musculoskeletal work, a lot of people go proximal to distal, but if you like distal to proximal, that works too. Really, again, the most important thing is that you look at everything and get into a routine so you don't miss anything along the way. When you're talking about the abdomen, most people kind of think of the abdomen as built in 4 quadrants with an extra middle portion that doesn't quite fit in any of the quadrants. And that's probably the easiest way to think about it, and most logical way for most people to think about it. So basically you have your cranial quadrant, where liver, gallbladder, stomach, left side, kidney and spleen, right side, another kidney, duodenum, caudal part, bladder, reproductive tract, and then kind of that central area of the GI tract. And I'll go into a little bit more detail here in the next several slides. But again, this is kind of where you figure out what you want your general approach to the overall abdomen to be, and then you kind of go looking quadrant by quadrant, again, making sure you're looking for all the organs you're supposed to. So a lot of people may start in the cranial quadrant, look at everything there, then move to the left quadrant, everything there, then caudal, then right, and then end in the middle. Obviously, you can do that counterclockwise. You could start with the caudal quadrant and go toward the cranial. I was taught in a kind of a weird Zorro fashion, starting in the cranial quadrant, then moving to right, then left, then caudally. The reason for that being you could look at liver, stomach, pancreas, and then continue on pancreas from the left lobe down to the right lobe. Then while you're on the right side, you look at the kidney and everything, and then you just looked at the kidney on the right, so you might as well look at the kidney on the left, so you hop over, do everything on the left side, and then roll back caudally. So a bit atypical probably to most people, but logical to at least my mentor. So again, as long as you have your own method for looking and you deliberately look at everything you're supposed to, the precise mechanism and pattern doesn't really matter. So you really have to remember who lives in all these quadrants, and not only who we normally see, but what organs we may not see unless they're abnormal. Cranial quadrant, really liver, gallbladder dominate the quadrant. Common bile duct is in there, and you should certainly look for that in any patient. Stomach sits just caudal to the liver. The left lobe and the body of the pancreas are just caudal to the stomach, and so you should be able to at least find the area of those. You may or may not see the pancreas in any given patient. Just caudal to that, you're going to find the colon, which I've mostly included in the central area of the abdomen, but that kind of makes your caudal margin of the cranial quadrant. And then remember, looking at the big vessels, you've got aorta running through there, caudal vena cava, hepatic veins, portal vein, which can be important. I'm not going to spend a lot of time on each individual organ. That'll be for later in the semester when we're talking about the organs specifically. But again, you're going to get full views of the liver, the gallbladder, like we see in this top image, and then just caudal to that, you'll have the stomach. So nice rugal folds of stomach here in this lower image. You can see the just cranial to the stomach is the liver here. Moving to the right quadrant, so again, I'm kind of following all right, I looked at the pancreas, now I'm going to slide over and look at the rest of the pancreas. Remember, the pancreas right lobe is over here along with the duodenum. Again, in any patient, you may not see the pancreas or the entirety of the pancreas, but it's going to be important to look for it. Most of the big things in the right quadrant are really the right kidney, antitureter, and the right adrenal gland, and again, the duodenum. And those are fairly easy to find most of the time. The right adrenal often ends up pretty tucked up and under, so that's kind of the most challenging big thing that we usually look for on this side. Other things there, right ovary, right uterine horn. If you have an intact female, again, you're going to have great vessels at the edge of the right quadrant. Right kidney should be findable right up against the liver. Makes for that nice comparison I've talked about before. Liver and kidney should be essentially isoechoic to each other when you're comparing liver to the cortex specifically. Again, you're going to have duodenum running through there on the right side, usually just lateral to the right kidney. You can see the nice stripes here. You've got the multiple layers from the luminal surface to mucosa, submucosa muscularis, serosa. So we should be able to identify those. Immediately adjacent to the duodenum is the right lobe of the pancreas, which you can see some of here. So it's always important to look for all these organs, even if you don't necessarily identify them, such as like the pancreas. So now I'm going to hop to the other side of the abdomen. I just looked at the right kidney, so I might as well look at the left kidney for a comparison. So left kidney, left adrenal, similar arrangement as on the right side. Usually a little bit easier to spot the left adrenal than the right one, just because it's not quite as tucked up under the ribs. Remember that the left kidney and adrenal are a little more caudal in most animals than the right kidney and the right adrenal. Spleen, be sure to look at the entirety of the spleen. Splenic head tucked up under the ribs. Splenic body kind of flops. Could go straight down the left body wall, could kind of cross over midline. You just kind of have to follow it where it goes. Again, some parts that some animals have and many don't. And again, you're going to have great vessels at the medial margin of the left quadrant. Spleen, nice uniform uniform echogenicity, uniform texture. Left kidney, again, pretty easy to find. A lot of times it's a little bit more lateral than most people who are starting out are scanning. So if you don't find it early, maybe slide the probe just a little more lateral and you can run across it there. After all that, I go caudally, so we get to the reproductive tract, if it's there, what part of it's left, and the bladder, as well as the ureteral insertions. And we don't usually see the ureters in any of these quadrants if they're normal. Normally, we're not going to spot them. If they're dilated, we will see them, but in a normal dog, I don't expect to see the ureters at any portion of their length. You can see the proximal portion of the urethra until it dives back into the pelvis and you get shadowed out by the bones of the pelvis. You should look for lymph nodes. We can generally find medial iliac and internal iliac lymph nodes back here caudally around the aortic trifurcation. You're going to want to look for the descending colon and rectum. Again, what part of it you can see until it goes fully into the pelvis. Prostate in the animals that have those. Uterine body in the other half of the animals that have those. Testicles, if they're retained, they're in the abdomen. Even if they're outside the abdomen, we usually look at them here just to be all-inclusive. And of course, once again, you've got your great vessels. Bladder should be nice and anechoic. At least the urine should be anechoic. The wall you should identify as the echogenic, fairly thin structure. And then a prostate, you can kind of follow the urethra as being a hypoechoic band. The prostate in a neutered dog is going to just be a small swelling around that urethra. If it's an intact dog, it'll be bigger than that. So we've hit the 4 quadrants. Now it's kind of time to go back and hit the GI tract and everything in the middle. So I really hit the duodenum already with the right quadrant. So then you've got mostly jejunum, a little bit of ileum, the colon, and then don't forget the mesenteric and ileocolic lymph nodes that live in here as well. If you're really good, you can kind of follow the GI tract from duodenum all the way through, following loop to loop to loop. That can be challenging in a lot of patients because gas and fecal material may shadow some of the loops. So ultimately, you may end up with kind of a back and forth sweep of the central abdomen, just making sure you look at everything, but not necessarily trying to follow the exact course of material through the GI tract. I've talked about this before. We'll talk about it again later when we talk about the GI tract specifically. But again, you should be able to see the nice layers of all of the small intestine, assess the GI tract for dilation, luminal contents, and so on. And that pretty much is the quick run-through of the abdominal anatomy. We'll hit more details as we go through the rest of the lectures in this semester.